Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We are in the midst of the COVID-19 pandemic. There seems to be a surge in Guyana right now as we're in the second week of April 2021. But at the same time, we're also in a big vaccination drive that has been touching the lives of many of our citizens and residents. As of today, we would have passed 50,000 doses of vaccines given to our citizens and residents. Today, I'm starting off this program and this discussion wearing my mask like I usually do to cover both my nose and my mouth. I will now take it off. As we continue our conversations, remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. So we have reached a stage now where we've passed 50,000 doses of vaccines administered to Guyanese. Right now, the only CARICOM territory that is ahead of Guyana is Barbados, and they have vaccinated first dose 60,000 of their citizens. By this time next week, we would have been passing everyone in the region, and Guyana would be number one. And this is the reason why I've always maintained a healthy pride in our public health system. The professionals that work there are completely committed, and want to thank them and acknowledge their efforts as we continue this fight in the COVID-19 pandemic. Every citizen deserves a chance, or the best chance, to be able to fight this COVID-19 pandemic. As it touches more and more of our lives, more and more of us will become affected, and some will become infected. Thankfully, the majority will continue to survive and do okay, but a few of us and a few families would unfortunately lose loved ones, and the hole and the gaps that are left can never be filled. And even those who survive after getting COVID, there is the well-known complication of long COVID that can stalk these patients. We don't know for how long. The pandemic has not been around long enough for us to know all of the answers. But we certainly know that there are people, even after they recover fully from acute COVID, they continue to have lingering effects: fatigue, chest pain, shortness of breath, and a lot of people, especially if they were in hospital, end up having severe and lasting psychological effects, particularly those that would have seen people around them not doing well or dying. And we continue to hope and plan that these people, as they survive and continue in their lives, that they get the kind of help that they need, the kind of support from their friends, their families, churches, in the community, that people come together and help each other to get over these scary times. In the midst of all of this, it is encouraging and it is good to know that Guyana has done so well in its vaccination program. We have over 100 sites dedicated to vaccinating people. These are fixed sites. Plus, there are mobile vaccination teams that are around the regions and in the heavily populated areas that can set up camp in a village, in an area, for a day or two and do mass vaccination in that area. In addition to that, we have mobile units that are going to people's homes for persons who cannot leave their homes and go to the actual vaccination site. And of course, those are all methods and teams that are put in place to ensure that every citizen would actually have a fighting chance to get vaccinated. We started off our program with the AstraZeneca vaccine, and as of now, we have managed to secure several thousands of the Chinese Sinopharm vaccine, as well as several thousand of the Russian Sputnik V vaccine. As the world becomes more and more familiar with vaccines, people are now starting to look at side effects. And these COVID-19 vaccines are not exempt from side effects. Every medication that we take have a potential side effect. It is up to the patient and the healthcare professionals to determine if the risks versus benefits are greater in terms of risks or benefits. We have seen that even though there are recognized risks with medications, that doctors and healthcare professionals would recommend certain interventions in patients because we believe that the benefits far outweigh the risks. Like, for example, a simple aspirin. People or my patients with heart disease, the majority of them are taking aspirin, one aspirin a day, because we have seen across the world that the benefits of taking aspirin in these patients far outweigh the risks. There are risks such as like bleeding from the stomach or irritated stomach or allergic reactions that can occur when you take aspirin, but these are rare and they are not seen too regularly, and even when they occur, they are easily recognized and managed. So vaccines in the COVID-19 era are no different. When I took my flu vaccine, I did get pain at the site of injection. I did get some sniffles the day after, some fever and chills. It's very similar to what I experienced when I took the COVID-19 AstraZeneca vaccine. Some fever, chills, and pain or tenderness in my left shoulder where I took the injection. It's the same feeling when I took the hepatitis vaccine. And even though it's been a while, I assume it was the same feeling that I would have had when I took the MMR injection. And everyone would react differently. There are people who would have no reaction whatsoever or very mild reactions to injections and vaccines. And then there are others who have a much more severe and a much more pronounced reaction. Thankfully, those with severe reactions are in the minority. And that's a big minority. They're not like 1 in 5 or 1 in 2 or 1 in 3. These are people 1 in 10,000, 1 in 100,000, etc. So we're grateful that with the use of modern technology, we've been able to develop vaccines that have, even though some side effects, they are no different than any side effect that we have really seen with vaccines. In Guyana, we do not yet have the Pfizer or the Moderna vaccine. And I recall in the early days of the Pfizer vaccine being rolled out, there was an alarm raised about people developing Bell's palsy after receiving this vaccine. Now, for those of you who do not know what is Bell's palsy, it's essentially one half of the face droops or becomes without nervous innervation or nervous control. So it droops in relation to the other side. And it can affect the eyelids, it can affect the cheeks, it can affect the mouth, and it can be temporary, or it can be periodic, or it can be much longer lasting. This was seen in about 4 cases after 1 million or so injections of the Pfizer vaccine. And it did raise some alarms in the early days. But guess what? When we looked at the number of persons who develop Bell's palsy ordinarily in the population with or without COVID or before the era of COVID, it does not seem to be more in the vaccine group. In fact, it was less. in terms of the incidence of Bell's palsy in the vaccine group. So these things happen more often in the normal population than in the actual vaccinated population. So at that point, we stopped thinking about this as a potential problem with the Pfizer vaccine. And right now, we are in a phase of alarm as well in some quarters regarding blood clots as it relates to a particular vaccine produced by AstraZeneca. The early indications would have suggested that this was related to a particular batch that was produced and distributed across Europe. In Guyana, we would have vaccinated about 40,000 persons with the AstraZeneca vaccine. And apart from the side effects that I told you about, which are things like fever, chills, aches and pains at the injection site, we have not had any reports, no reports of any significant side effects. And I talk about significant side effects, I am talking about things like blood clots, people going blind, people losing feeling in one half of their body, people falling dead. None of these things have happened. People have not started bleeding. So out of 40,000 people in Guyana, we have not had any reports of any major adverse side effects from any of the vaccines that we would have given. And the vast majority of vaccines given in Guyana were the AstraZeneca vaccines. I suspect that in the coming weeks, the Sputnik vaccine would probably overtake AstraZeneca as our leading vaccination choice, just because we have bought a lot more of Sputnik vaccine over the AstraZeneca vaccine. So just to put it in context for you, the incidence of blood clots in persons taking AstraZeneca vaccine. If you were to vaccinate 10 million persons, that's 10 million persons with the AstraZeneca vaccine, the incidence of blood clots is about 40 persons. That is less than 0.0000004%. That's a very, very small percentage. You have more chance of getting robbed walking down Regent Street than you do of having blood clots from the AstraZeneca vaccine based on current data. There's a lot more persons, unfortunately, having serious injury and even dying from road traffic accidents than vaccine-induced injury or side effects. So to put it in perspective, it actually tells you that the risks versus benefit ratio still favors benefits over risks. And this is true not just here in Guyana, but the relevant international authorities have said so clearly in their recent statements that the benefits of using the AstraZeneca vaccine far outweighs the risks. And again, if you were to think about blood clots, people who use, or women who use oral contraceptive pills are at far more risks of developing blood clots than people taking COVID-19 AstraZeneca vaccine. People on long flights, transatlantic flights, are at higher risk for blood clots from that flight rather than the COVID-19 AstraZeneca vaccine or any of the vaccines. From the COVID infection itself, people have a higher risk of developing clots than any of the vaccines. So it's good to recognize these potential side effects, but one must be realistic and recognize that every medication, every therapeutic intervention has some potential risk, but you have to weigh risk versus benefit in order to make an informed decision. And in my case, I have to weigh risk versus benefit in order to make an informed decision and tell my patients what my opinion is. And I strongly believe, based on current evidence, that the benefits by far outweigh the risk in taking these COVID-19 vaccines. So I hope this would have enlightened you and helped you to make a better decision in terms of getting your vaccines. And I want to thank you for joining me on the program, Your Doctor and COVID. If you have any questions, feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you.